Welcome. It is Friday, 12 p.m. Eastern Time, and you know what that means. It is time to Ask Dr. Geier. Wherever you're watching, I hope you're making today your masterpiece. I'm Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, anti-aging and regenerative medicine expert, and media medical expert. I help you feel and perform your best regardless of age, injury, or medical history. Very excited to have you. Fluffy Cookie says hello. It's good to see you. And Santosh, I don't know if I'm saying that right. Tell me if I'm saying it right or wrong. Says hello. Good to have both of you. And wherever you are, feel free to comment in the chat. I cannot see the comments in the comment section. All I can see are the chats messages, so that's where you can ask your questions. Please remember, as always, this is meant for general information and educational purposes only. In no way is this medical advice. This is the only time or place I do this sort of question and answer thing. I don't do it in response to the videos, the comments left on my videos. I don't do it by questions people email me. I don't do it on Instagram. I don't really use Instagram, but I don't do it on Instagram. I don't do it in blog posts. There's no comments on my blog post. This is your opportunity to do it, but just understand I'm giving you information that then you can use to sort of decide what that means for you. You could go ask your doctor maybe, hey, what does this mean? I heard this and that, but it is not telling you what to do in any way, shape, or form. For what that's worth. Most people get that. Amit, good to see you. Good to have you here. Distal femur fracture. 5 months, bone's not healing. Loss of congruity at the knee joint. Fracture's not aligned. Anatomical. And I think we've talked about this one actually. Get this off the screen. Sorry. It's a tricky problem. The distal femur, as it goes into the knee joint, if the distal femoral, if either the medial or lateral condyle does not line up well, it's going to heal with jagged edges. Those jagged edges are going to eventually grind out the cartilage on the top of the tibia, the shin bone below it. So that's why surgery to line it up really well is important. Now, if it doesn't line up but it's outside the joint above it, obviously you got to get it to heal, but that's not as big of a deal in terms of future arthritis. But if that joint surface of the femoral condyle is not lined up well, then you develop arthritis, and usually fairly quickly. As far as not healing, that's something that typically distal femur fractures, maybe there are some, but very, very rarely heal without surgery. You almost always need surgery to do it. If you had surgery and it's still not healing, then a lot of times, maybe there's a biological reason it's not healing. Maybe there's a structural reason, meaning, that somebody tried to use a nail when that wasn't the right type of fracture for a nail and you need a plate and screws or something along those lines. But you got to get it to heal, and you need the joint surface to line up. And it's complicated by bending of the knee is only 10 degrees. Yeah, that becomes a really tricky problem. That's the advantage of surgery right after a distal femur fracture, is that you can bend the knee right away. Once the knee gets stiff, yes, there are surgeries to go in and scope the knee and clean out scar tissue. They don't tend to work that well in my experience. So you want to prevent a stiff knee more than treating it. You want to prevent it before it ever gets stiff. But once it happens, then you're talking about removing scar tissue and using these continuous passive motion machines to try to maintain the motion you get from that type of surgery. Hope that helps. Santosh, ACL ligament ACL surgery 2 years ago, left knee. How many years ACL ligament? It should be strong enough within 6 to 12 weeks after surgery, the graft to be strong enough to support walking. Running is usually around 12 weeks. Sports, a little bit further out, but until the graft, now this is with an autograft. Allografts would be a whole lot slower, meaning cadaver grafts, but autografts usually by about 6 months are as strong as your normal ACL. So it 2 years ago, it should be there now. Even an allograft should be there now. But I do worry that even at full strength, an allograft might not be strong enough to support the knee. I'm not a huge, as I've talked about on this Ask Dr. Geier show before, not a huge fan of allografts for ACL surgery, meaning using a donor tissue. for what that's worth. And then Amit, along the same lines, does an ACL graft last a lifetime? It should. It absolutely should. Cadaver grafts, allografts, have a much higher failure rate. Some studies say it's about 4 times as high, compared to an autograft. But the purpose of any of them is to get them to last forever. Now, obviously, there is a failure rate, and it depends, again, autograft versus allograft and some specific other factors. But the goal is absolutely to have it be the only one you ever need, to hopefully prevent you from needing a revision surgery, because that's a much bigger surgery and has lower success rates. Santai, ACL ligament tear in the right knee, now it's manageable to walk after the left leg surgery. I'm a little confused here. Oh, so his ACL surgery was on the left, and then he had one in his right knee as well. That's tough. I don't know. I assume that's sequential. I have seen very few people tear both ACLs in the same injury, but I guess it could happen. But yeah, you would typically do one and then come back and do the other. How long between the two? I would say would be a little bit of a difference. I would say at least 6 weeks. If you can do 3 months or 6 months, yeah, so much the better. But it would be really hard to do both of those at the same time. Really hard to rehab 2 ACLs at the same time. You really need a good one to depend on, while the other one's getting stronger and getting its motion back and things like that. All right, what else? That is all I've got in my chat so far. If you have questions, you got a few last seconds to answer that while I'm saying that. If you'd like to come to Charleston, South Carolina and see me, I'd be happy to. Again, I triple board certified, so not just traditional orthopedic surgery treatments, but some of the anti-aging and regenerative medicine treatments. We can talk about all of it to help you get back to what you love to do. I see patients in Charleston, South Carolina, so yes, at least the first time you got to come down here or over here, depending on where you are, to see me. The information is on my website, drdavidgeier.com, which you will find a link to in the description below this video. Okay, that's it. No questions. I hope you have an amazing weekend. It's Halloween weekend here in the United States, so I hope all of you have a safe and wonderful Halloween. If it's not Halloween in your country, it's not something you celebrate, I hope you have an amazing weekend, and I look forward to seeing you real soon. Have a great rest of your day.